Real-world case studies highlight effective approaches to addressing nutrition challenges. In Mumbai, India, a CMAIM program integrated community-based management with government growth monitoring, reducing wasting among children under 3 by 28% through community health worker involvement and culturally sensitive communication. A WFP nutrition barrier analysis in Armenia used mixed methods to identify barriers, leading to tailored education and adapted food assistance that improved outcomes. In Chad refugee camps, Mississippi, conducted routine MUOC assessments, integrated health services, and used telemedicine, enhancing malnutrition management. WFP multi-country programs linked cash transfers and school meals to nutrition outcomes, succeeding through community engagement and integration with health and education systems. Additionally, nutrition vulnerability analyses in humanitarian settings used participatory, consensus-driven assessments to enable rapid, context-specific interventions. These examples emphasize the importance of tailored community-driven strategies for effective nutrition programs. In this section, we will talk about educational curriculum, competencies, strategies, Tharni AMP, activities. Developing an effective educational curriculum in nutrition and health requires a combination of core competencies, teaching strategies, and practical learning activities. Core competencies include skills such as nutrition and food security assessment, both subjective and objective, cultural competence, health education and advocacy, data analysis and prioritization, and interdisciplinary collaboration. To teach these competencies, strategies like case-based learning, simulation, experiential field training, online modules, resource mapping, and interprofessional workshops are highly effective. Example learning activities include conducting a community nutrition needs assessment through surveys or focus groups to identify local issues, engaging in role-play simulations to practice patient interviewing with assessment tools, completing a resource mapping exercise to identify local resources addressing food insecurity, and performing a case study analysis to evaluate and propose interventions for malnutrition cases. This blend of competencies, strategies, and activities ensures a well-rounded, practical, and impactful learning experience. Let's finish this lesson, assessing nutrition and food security in resource-limited settings with a scenario. A 35-year-old woman in a rural community presents with fatigue and weight loss. She reports limited access to fresh foods and relies on staple grains. Students are tasked to assess her nutritional status, screen for food insecurity, and develop a culturally appropriate intervention plan. Now, please answer to these knowledge check questions. 1. What are the key indicators of malnutrition in adults and children in resource-limited settings? 2. How does cultural background influence nutritional assessment and intervention? 3. Which validated tools can be used for rapid nutrition and food security screening in the community? 4. What community resources can nurses leverage to address food insecurity? 5. How should nurses prioritize nutrition-related health needs when resources are limited? Nurses in resource-limited settings must be adept at using practical, evidence-based tools and participatory approaches to assess nutrition and food security. By applying frameworks like the UNICEF Conceptual Framework, using tools such as MUOC and HFEAs, and engaging communities in prioritization, nurses can identify key risk factors and drive effective, culturally sensitive interventions. Real-world case studies demonstrate that community engagement, simple tools, and adaptive strategies are essential for success. Competency-based education, simulation, and field experiences prepare nurses to meet these challenges and improve community health outcomes.